What we're gonna do today is we are going to find out if this horse has gastric ulcers. In order to find out if a horse has gastric ulcers, we need to pass a tube into the stomach. In order to pass a tube into the stomach, we have to navigate through some loops right there. So we're going into the throat, and now we're gonna ask her to please do me a favor and swallow, and she did a very good job. So what is happening right now, you won't see much. Why not? Because we are on our way down to the esophagus. So right there is the esophagus. I'm gonna turn the screen a little bit towards you so you can see more. So that's the esophagus, and we are getting very close to the tummy. Oh, and almost there. Almost there. So what Valerie is doing right now, she's pumping a little bit of air and a little bit of water. Voila. We're in the tummy. Okay, good. Now, that's the tummy. Now I need to put a little bit of air in there. We need to fill it up. Fill it up. Now we wait. This area right here, that is the Margo Plicatus. That is one of the most common areas where there are ulcers. This particular horse has very tiny little pinpoint ulcers right there. There are two parts of the stomach. One of them is the glandular stomach. Go in a little bit, please. Just a little bit. Okay, great. One is the glandular stomach. The other one is a non-glandular stomach. This is a very nice ulcer right here. Right here. These are ulcers. This horse must be having a little bit of pain associated. So right here, there are ulcers right here. All of these are ulcers.
But because there's water there, but...
Yeah, no, that water is fine. I just don't want to get in the water. But all these are ulcers. Okay. Right here.
Only when I see ulcers.
They are ulcers. Oh, you can leave a lot of it there, but... Oh, look at this. The ulcers around the Margo Plicatus right there. And then Valerie, I'm gonna want you to twist a little bit. Okay, stop. Now come back out a little bit. Oh, look at this. This is a very powerful ulcer right here, right there. Damián, ¿estamos grabando?
¿Cómo?
¿Estamos grabando?
No sé, porque nunca he...
Okay, come back a little bit. Oh yeah, let me see all these, or that is small bleeding ulcers right here. This is pretty significant. This is the Margo Plicatus right here. And these are... Oh my goodness. Right here, significant ulcers. There are multiple things that could cause ulcers in the stomach. It could be stress. Stress-induced. Horses internalize, what we call internalized stress a lot. And a lot of time that causes ulcers. Sometimes diet can cause ulcers. Different types of bacteria could cause it, although it's relatively rare. But just like human athletes, stress will actually do it for them. That's a better job. So now what I did is I went in the stomach, I went all the way in the stomach, and I twisted, and I'm looking further up in the esophagus. So right here is where the esophagus is coming. How do I know that? You see? The esophagus is coming right here. You see that? That's where my tube is, coming out of the esophagus. This is the ulcer, significant ulcer right here. And this is my scope. So I'm looking further up. All this is erosions, significant erosions. So what we're doing here is we are providing suction, sucking water out of the stomach so I can have a better visualization into the stomach. And I want to go deeper into this area over here, what we call the pylorus, which is the connection between the stomach and the small intestine. Right there, that's the pylorus. Just go slowly in, slowly in, slowly Yeah, slowly in. We're getting in. We're getting it. Now we're gonna start playing a video game. Right there, we got it. Pylorus, hello. We got you. You're my friend. Now, if this horse would have not drank that much water last night, we would have actually been in the pylorus way like an hour ago. Right there. You see the opening? Very nice. Well done. We can go in a little slowly. We can play like a little video game over here. Right there. Good job. You see the stomach? Oh, doesn't get any more beautiful than that. That is a great view of the pylorus right there. So we have completed the gastroscopy. So what I'm showing you right there, that is a bleeding ulcer. That's a grade 4 ulcer right there. You can see the blood coming out of it. Those are painful little babies. And now what I'm doing is I'm getting into the pylorus for a second time. So now Valerie slowly pushing. Right there. Oh, I'm zooming in. So this is the small intestine. That is the entrance to the small intestine. Good. Entrance to the small intestine. Now come out a little bit. This is the pylorus. Great visualization. Now come out slowly. Slowly come out. Maintaining that, maintaining that view. You see, this is liquid from the intestine leaking right there. This is an ulcer. There's an ulcer right here.
That's huge.
There is an ulcer right there, and there is an ulcer. That's a grade 4 stomach ulcer. This is causing this horse a lot of pain. A lot of pain. All right, now we're gonna suction, and bye-bye. Now I'm gonna get all that air out. We're gonna get all that air out because we don't want this horse to colic. And if they're full of air in the stomach, they can't colic. So what I'm doing right now is I'm removing all that air that I put in. I'm removing it, shrinking the stomach so that she's more comfortable. Then we're gonna treat it with omeprazole, 28 days, maybe 31, we repeat.